two exam mistakes are killing your production. I don't care what specialty you're at, but if you are making these two mistakes, you are losing your new patients every single week. And that's costing you thousands of dollars weekly. What have you been told when it comes to your exams? You've been told to train your salesperson, right? To send them to the training, to turn them into closers. Again, I don't care about your specialty, whether it's a treatment coordinator or your front desk person is doing the sales part, or maybe it's your front desk. Does that matter? Your office manager. You were told that you need to train a salesperson. So you send them to these closing institutes to make them into a closer. Let's have a quick reality check. You only need a closer if you are selling something that patients don't want. So you need somebody to close that. And that's a whole different issue. But that's not what you're doing. You don't need a closer. And also, as a matter of fact, you actually don't even need a salesperson. Do you know why you need a salesperson? If you have a lot of patients waiting for you in the bay, in the treatment area, so you have to quickly pop in, do an exam, and then pop out. You only need a salesperson if you're in the volume model, my friend. If you see a lot of patients, if you take dental insurance, yeah, then you need a lot of staff. But let's not forget something that somehow everybody in the industry has forgotten. You, as a doctor, have the most authority in the exam room. Who has the most amount of power in the exam room? Is it your treatment coordinator? Is it your front desk person? Is it your salesperson, the best salesperson? No, it's you, doctor. You have the most power, but because you've been put in this volume model with insurance, you're running around, so you don't have more than 5 minutes, 10 minutes in the exam room. And that's what's costing you conversions, because you're relying on your treatment coordinator and you're making these two mistakes that I'm going to teach you today to avoid. How many of you have had an exam, have had a patient called and demanded to be seen? We have to be seen now. We have to travel for summer, or the school starts, or the surgery or kitchen remodel. Like, you have to see us right now. Fit us in right now. In orthodontics especially, we're so brainwashed into like same day start. Do not let new patients wait. So you fit this person in, you're like, of course they're going to start treatment. Like they couldn't wait to be seen. And then you do your whole spiel, you do your exam, and then the patient says, let me think about it. What happened? They were literally demanding to be seen. What happened? This is what happened. You made one of those two mistakes. And today I'm going to teach you what those are. So let me ask you this question. What do you do from the moment you come into the exam room and you greet the patient and say, hi, how are you doing? You make the small talk. How's the school? Whenever the vacation or the holidays happen, you make the small talk. What do you do next? You jump into a clinical exam, right? You may say something like, hey, Mrs. Smith, so great to see you. Thank you for coming. How are you doing? Hey, Johnny, how's the school going? How's the summer break going? So it looks like you guys are interested in braces. Looks like you guys are interested in a crown. Looks like you want a checkup. Looks like your denture is not fitting. And then you jump into a clinical exam. This is the mistake number one. I want you to really lean in and slow down. This is a missed opportunity to figure out exactly why that patient scheduled an exam with you. They will put something superficial in their paperwork. I want braces. My child is snoring. I want a new denture. My tooth hurt. This is very general. This is very macro. This is not going to help you have 100% conversions in the exam room. You need to know exactly what that patient wants so that your expertise is a match. And sometimes it's not, and it's a beautiful thing. And as a matter of fact, if it's not, and you tell the patient, you know what, I don't think I can help you, but I can send you to somebody else, I can bet your money, and a lot of money, that that patient is going to refer you a ton of people. Because they will say that you're a very honest doctor, you have great integrity, great ethics. Go to her because she didn't try to sell me anything. And her closer TC didn't push something that it didn't quite want, but nobody really cared enough to actually ask me that and dig. So what I want you to do is, from the moment you walk into the exam room, in between the small talk and your clinical exam, this space right here is critical. After the small talk, I want you to ask, Mrs. Smith, so tell me a little bit more why you're here. I see that you're interested in braces for Johnny. Tell me more. Has anybody had braces in your family? Are there any specific concerns? What about the crowded teeth? Is it hard for him to brush? Is it hard for him to floss? Is there anybody's making fun of him in school? What about the family history? Do you guys have a lot of dental work in the family? Has anybody had Invisalign? Has anybody had braces? What is your experience? What do you know about sleep? Like maybe you're an airway orthodontist like me. What about anybody in the family has a sleep issues or a CPAP? She's going to open up. She's going to start talking. And right there, you will know specifically why they're here. But so many of you are rushing through this point and like, hello, hi, my name is Jana. I used to do the same thing. I'm not like on the ivory tower over here teaching you overview something that I haven't done. I have done that, but then I've learned from my mistakes, and that's why I'm teaching you here. So I want you to slow down and ask all of those very specific questions to figure out exactly why she's here or he's here. And don't stop at one. Make them talk. Use that time. Oh, we're interested in X. Tell me more. Literally just that sentence is going to make you thousands of dollars. Tell me more, period. Close your mouth, look at the patient. Don't be afraid of an awkward 20-second pause. It will make people talk. It will make people lean in. Because humans, we don't like pauses. It feels awkward, so one of us is going to start talking, and that better be a patient. Because we want to figure out exactly why they're there. Because we're either a match or we're not. And every time your patient says, we need to think about it, I had to talk to my husband, it's not a good time. Really, it's not a good time. Like, you did not know it's not a good time before you schedule an exam. These are all superficial objections. And you don't need a closer for that. You need to figure out exactly what that patient is there. And they have scheduled an appointment with a dentist on a Tuesday morning, not because they have nothing else going on, but because they are there because they want to say yes to your treatment. But it has to be customized. You have to figure out exactly why they're there. So really dig in and ask those questions and go in depth. Okay, but why here? I've coached a private client on this. She's a general dentist, and she had a patient who had terrible oral hygiene. And she didn't just judge her. She didn't just brush over her, but she started asking these questions. She asked her, okay, so tell me what's going on. Why are we not, I can clearly tell that you're not taking care of the teeth. Tell me what's going on. Do you know what happened? Woman broke down and started crying and telling her that her husband was just admitted to the hospital. And so he's on this life support and she's just terrified, doesn't know what to do. And so my client was able to tell her, okay, listen, you really got to take care of your mouth because your husband needs you. If you're in pain, if you're constantly coming here for an extraction or a root canal or the quick fixes, that's taking your time away from your husband, and he really needs you. Really figure out why that patient is there. So that's your mistake number one. You're rushing through this part. And again, I understand if you're seeing 30, 40, 50, 60, 100 patients, depending on specialty, I understand that. But slowing down and really considering moving more into low volume, fee-for-service practice where you do have more time for this, because your patients, let me tell you something, your patients that you actually found out why they're here, and then you also know your niche, and so you're marketing specifically to those patients, they will pay you 2 times, 3 times your fees. They will pay you $15,000, $20,000, no matter what you do. They will, because you're the exact match for their high value specific problem. But right now, you're not focusing in your marketing on that. So you're just taking anybody, and it's a volume model. And so you're running around. And so my invitation for you is this week, next week, it's Friday, next week, at least for 1 or 2 of your exams, slow down. and really ask them that question after the small talk. Why are you really here? Okay, so that was the mistake number two. The mistake number one. The mistake number two is after you had asked them that question, you're jumping into your clinical exam. Before you do your clinical exam, and by the way, so many of you are doing clinical exams like it's a formality. I know it because my private clients, they send me the recordings of their exams and I know what you guys are saying there. So that's you, I see you, and that's okay. I was there too. But a lot of you are doing the clinical exam and then I was like, okay, so how do you feel about Invisalign? So what do you think about the crown? I know you need a crown. Like you're just jumping to the diagnosis and trying to feel the patient. And that feels salesy. That feels eek. Because the patient doesn't feel like you have custom created approach for them based on what you just saw in the mouth. It almost makes it feel like the clinical exam is just a formality. Like, why did you even look at it? Like, what did you see in the mouth? Like, you can just tell me already that I need treatment. Like, then why don't we do this whole mirror thing and you telling your treatment coordinator these weird words, right? You have to position your exam in the way how it's the piece of the puzzle that invites the patient to understand why they need treatment. Here's how you do that. Before you do an exam, you want to, in just a couple of sentences, but you want to position what you're about to do uniquely from other doctors. What does that mean? You have to explain to the patient how what you're going to see in the mouth is important and why, and how is it different from other people. For example, Mrs. Smith, I'm going to look at Johnny's teeth, Johnny's crowning. Most doctors do X, but we here at our practice, we actually look at Y because that is the root cause causing the Z. Explain to her, explain to him logically the steps. I'm going to check the probings because it leads to this. And if they're this number, that means we need X, Y, Z. Then the patient is going to lean in. Now the patient is participating. She's not just, or he's not just sitting there waiting, or if it's the patient, they're not just sitting in that room and like, okay, well, whatever the doctor says, gosh, how much is it going to cost? They're like, oh my God, I want to know the answers of your clinical exam. Tell me what you found. They're leaning in. You've got them paying attention. And that is the best kind of patient. The kind of patient that's engaged is the kind of patient that is actually going to follow your recommendations, is the kind of patients that will always show up on time and they're going to pay on time. And they're not going to go smoke after you just place an implant or eat something hard. Like they will actually follow your instructions and they will get the best results. In my world, I call it the dream premium patient. But that will be, you are literally creating your best patients, but by the way you interact with them. And what I want you to do is I want you to set that precedent for what are you about to look at in the mouth and how is it very different from other patients. If what you're doing is something, maybe it's not specifically what you're looking in the mouth. Let's say I have a client who is, her whole model of her practice is based on patient comfort. Then before you invite the patient to sit in the chair, tell them about the chair. Tell them about all the cushions and all the lumbar support and all the things and how, like, set the precedent for how comfortable their appointment is about to be. So let's summarize. These two mistakes that you're doing, they're so easy to correct, but so many of you are missing them. Biggest reason is because you are rushing. You're in the volume model. You're just trying to see the next patient, the next patient, the next patient. But I want you to slow down for now and strongly consider going through my whole program and figure out your niche, figuring out your dream premium patient so that you can market yourself very differently from other doctors who can actually charge 2 times, 3 times your fees. Then you will not need so many patients. You can see 2 times fewer patients and make the same money or more. Then you'll have a lot of time. But even when you have a lot of time for exams, you still need to make sure you don't miss these 2 things. So let's quickly recap. The mistake number 1 that you guys are making is when you're walking into exam room and you're making the small talk, you're quickly jumping into the exam. the clinical exam. Don't do that. After you made the small talk, really slow down, spend just a couple of minutes. I'm not telling you to spend 40 minutes, just spend a couple of minutes, but figuring out why that patient is there and really dig deeper to truly understand. You will be able to tell that they're telling you the truth by their facial expression. You will suddenly see the concern on their face, or you will see a relief. Sometimes they will even start getting emotional. That's okay. And we're all humans. We get that. That's how you know they're invested. And that is the exact problem you are solving. When your services are a perfect match for the exact problem that your patient has, they will always say yes to your treatment. It does not matter how much you charge. You are the category of one expert to solve their problem. Your patient will feel seen, heard by you, understood. Nobody will walk out from that room. I don't care about their finances. They will figure it out. Nobody will walk out and say no. They will figure out the money. They will do the payment plan. They will do 3 credit cards, whatever they have to do. But you are that match. You're the solution. They have cancer and you're a cancer doctor with a specific technique. How would they not go to you? That makes no sense. But in order to do that, you have to figure out exactly what their problem is. And then before you do your clinical exam, just in a couple of sentences, explain to them how what you are about to look in the mouth and your whole treatment philosophy in your practice, how it's different and unique from other doctors. Position your treatment. When you do these 2 things, you're guaranteed to have 90 to 100% conversion exams. That's what I have. That's what my private clients have. That's absolutely what you can have regardless of your specialty. And if you want my eyes on your current exam process, so I can show you your blind spots that are killing your conversion, all you need to do is DM me the word cash or write it down here below in the chat. Just send me the word cash, CASH, and I'll send you more information about how I can help and the private coaching. All right. Have a beautiful rest of the week. Bye, y'all.